I am now pleased to welcome you all to our next session, which is physical exercise during cancer treatment, which will be presented by Dr. Melanie Potiaumpai. Dr. Potiaumpai is an assistant professor in the Department of Medicine, Division of Hematology and Oncology at the University of Pittsburgh, and a member of the Biobehavioral Cancer Control Program and Exercise Oncology Lab at UPMC Hillman. Please help me welcome her to the stage.
Good morning, everyone. Thank you for joining me on this Sunday morning. I know it's a bit early and it's really nice outside, so I appreciate you coming inside just for an hour or so just to hear about exercise, which most people don't like to hear about. But by the end of this session, I'm hoping I can convince you to go outside and do some exercise today and every day afterwards. All right, so I'm going to tell you a little bit about myself, just so you get an idea of what I do in terms of my profession and my research and how I got into exercise oncology and where exercise oncology starts. So I am from Miami, Florida. I did all my schooling at the University of Miami, if there are any hurricane fans out there. I specifically did my training in older adults and active aging, so how to use exercise to help the aging process. And then when I did my dissertation, I wanted to challenge myself, really. And so I decided I wanted to branch out into the oncology field. So I did my training under fire with hematologic malignancies when exercise wasn't really a thing, where doctors were saying, no, we can't exercise, you shouldn't exercise, and kind of closed the door, in my face, saying that we're not going to give you any patients. But I persevered, and I work with stem cell transplant patients specifically, and as we know, some lymphomas do head towards stem cell transplant. I then did a fellowship at Penn State in Hershey, where I worked with other solid tumors and then continued my work with hematologic malignancies, specifically stem cell transplant, which is where a lot of my funding came from. And then currently I'm at the University of Pittsburgh, where I continue to work with hematologic malignancies. I'm also branching out into more niche, underserved cancer populations, including lung and esophageal. So enough about me. The next slide, I'm going to put up a couple of statements, and they're the stages of change in terms of exercise. So if you're not a current exerciser, or you want to be, or whatever your level of exercise is, I want you to think about and see if you resonate with any of the statements. And my hope is that you'll resonate with one of them, and then we can move you and push you into the next stage of change towards getting you to exercise regularly. So a lot of times I meet patients who are getting treatment or who are survivors and say, I do not exercise and I will not exercise, please leave, right? That might have been you, that might be you, or someone who is like that, or you might be the next stage. I do not exercise, but I have started thinking about it. It's kind of catching my interest. I've heard people who do it, I've heard the benefits of it, but I'm not really sure how to do it. The next is, I recently tried to exercise, but I've been unsuccessful, which I feel like a lot of patients and survivors tend to fall into this group, where they've started on some trend that they've maybe seen online or they've heard their friends doing. They've tried it, they didn't like it, or they didn't know how to get into it, so they just kind of gave up. And the next is, I've been exercising for a few months and it's been going quite well. I've worked it into my schedule, into my routine, and it's become a habit. And let's see if we can change that into, I've been exercising regularly, and this is part of my lifestyle now. So if any of those kind of resonate with you, my hope is that I can get you into the next stage, and then as you get into that next stage, you just kind of roll with it. So let's talk about really what exercise is, which may seem a little bit elementary, but a lot of times the patients that I work with, they tend to not know what exercise is. They tell me what they do, thinking that it is exercise because it might seem like a lot of effort depending on where they are during their cancer treatment journey. So we're going to differentiate between the two and see if we can, you can take stock of what you're actually doing. So physical activity is any bodily movement that we use our skeletal muscles and our bones to produce, and then that requires energy expenditure, usually coming from the food that we eat. It could be anything done during leisure time, getting to and from work, transporting yourself, moving yourself, or as part of a person's work, so you might be occupationally active. So examples of physical activity include cooking, activities of daily life like cleaning, gardening, walking your dog, or going to and from the mailbox. And I know it seems like I said very elementary, but a lot of times when I ask patients, they say, "Oh yeah, I went to the bathroom today. That was quite the workout for me," which it seems it is because it is a lot of effort, especially if you're undergoing treatment. But unfortunately, that doesn't count towards exercise, right? So if we look at what exercise is compared to physical activity, exercise involves being a planned, structured, and repetitive bodily movement, meaning that we set aside a certain amount of time during the day. It could be 5, 10, 30 minutes to an hour. And we do exercise to improve some type of physical fitness component. And I'll go into what the physical fitness components are in exercise oncology. So if you kind of think about what you've been doing for exercise or physical activity, which category do you fall in? All right, so we'll talk about physical fitness components. And in the exercise world, outside of cancer, there's so many components that a lot of people like to put into what counts as physical fitness. And this is specifically for exercise oncology and in the exercise oncology field, so specifically for cancer patients and survivors. And what we as a field have deemed the most important components for your physical fitness to be able to withstand treatment and then transition into survivorship and live a well life. So you can see from this pie chart, everything's divided 20% pretty equally. So we start with aerobic exercise. So that's something like jogging, running, cycling, anything that gets your heart rate up. The next is strength exercise, so resistance training. So you could be using dumbbells, resistance bands, anything that works your skeletal muscle to build that muscle strength and that muscle mass. The next is flexibility and range of motion. Some exercises you could think of flexibility and range of motion as actually just stretching, so static stretching, right? If you get up out of bed and you're stretching, that's for flexibility and range of motion. You could think of yoga, right? That's probably the most common exercise people think of for flexibility and range of motion. The next is balance training, which a lot of people don't think about because if we go to the gym, there is no specific exercise equipment that we do for balance training. So it's one of those things that either you're prescribed and you're taught to do, or you just have really good balance, which most of us don't. Again, balance training could be Tai Chi, it could be yoga, or specific exercises targeted for balance. And the last physical fitness component, which I know maybe some of you are very excited about, is rest and relaxation. So rest and relaxation is a very important component of physical fitness to be able to elevate these other 4 components and to make sure that you are using exercise to its full benefit to help you through your cancer treatment and into survivorship. Because again, exercise is meant to be complementary to your treatment rather than replacing it. So if your body can't handle the treatment and the exercise because you're not giving it enough time to recover, then everything that you're doing is kind of a moot point, right? So here, like I said, this pie chart depicts all these components as equally important in terms of 20%, all the way up to 100. But realistically, whether someone has a chronic disease such as cancer or they're healthy and they're exercising, there's no possible way that you can fit all 5 of these components into, let's say a week of exercise. It's just not realistic and it's not possible, and no one should try to strive for that. So later in the presentation, I'll go through a couple of scenarios where we kind of play with the percentages of what you might want to do in terms of where you are in your treatment journey and how we kind of modify the exercises. Okay, so I told you, these are the components that you should be doing. So what are the guidelines? How am I supposed to know how much I'm supposed to do? So the American College of Sports Medicine every 10 years does a roundtable of exercise oncology professionals that look at the evidence and all the research that's currently out there, and they come up with a guideline to see how much exercise we should be doing and what type to be able to better target the symptoms that a lot of cancer patients and survivors are experiencing to see what's going to be the most beneficial. So what they've said is that we can do either or of aerobic exercise 3 times per week, 30 to 60 minutes per session. So it's equivalent to about 150 minutes per week of aerobic exercise. Or if you're not a fan of aerobic exercise, such as myself, and you prefer resistance exercise, which is strength training, resistance bands, dumbbells, weights, anything like that, we're looking at 2 times per week, and that's 2 sets of whatever type of exercise that you want to do, and if you were looking for specifics, I'll talk about that later, and about 8 to 15 reps. And this seems very generic because this targets a whole smattering of different types of cancers, not just lymphoma, but just a lot of solid tumors as well. And what they found is that this specific prescription of exercise is beneficial to target different symptoms such as sleep, GI issues, functionality, anxiety, depression. If you're more ambitious and you don't want to do one or the other, you can do both. So you do 2 to 3 times per week of aerobic exercise. You lower the duration, so instead of 30 to 60 minutes, 20 to 40 minutes, in addition to resistance exercise 2 times per week, again, 2 sets to 8 and 15 reps. And those can be on the same day, or if you want to take a break and you went for your jog, you went for your fast walk, and you're tired, you do resistance training on an off day that's not aerobic exercise. So again, this is very generic guidelines. It might not apply to everybody, especially since if you're on a different part of your cancer treatment journey, this might be too much. Or if you're really ambitious and you're exercising regularly, it might not be enough. So we'll go into what else we can do. And these guidelines have worked. They are supported by the American Cancer Society, CDC, the National Cancer Institute, so they have held up for the past 20 years, since the first original roundtable has come out with these specific guidelines. So given that we know what we should be doing and all of these big organizations are telling us to exercise, surprisingly or unsurprisingly, we are not exercising enough, and that includes just the general US population, but also cancer patients and cancer survivors. We're just not exercising enough. There was a recent paper come out where they surveyed cancer patients and survivors, asking them just how much do you exercise? What are the barriers to exercise? And did your doctor talk to you about exercise? And maybe surprisingly or unsurprisingly, 53 to 70% of survivors are not meeting those guidelines that I just put up. 3 times per week of aerobic exercise, 2 times per week of resistance exercise. So that's a really, really high proportion of patients and survivors who are not meeting those exercise guidelines. So as a researcher, I also try to figure out how can we, decrease this number and get you to actually exercise. So, what's the deal? Why aren't we exercising enough? Why aren't cancer patients and survivors exercising enough? And there's a whole, field of just looking at exercise barriers and facilitators and getting people access to exercise. But the main reasons that keep popping up in interviews of patients, interviews of doctors, and interviews of caregivers are these 3 themes. It's just an old school thinking. Exercise, like I said, even just 5-6 years ago when I was doing my dissertation as a PhD student, doctors did not want to talk to me about it. They did not want me to talk to their patients, so I just kind of, crept around like a little mouse, trying to talk everyone's ear to do exercise. So it's a very old school way of thinking because we think that exercise is not safe because we have this thought of what exercise is, throwing around weights, going to run a marathon, doing this really, really high intensity yoga where we're putting our legs behind our head. So it's just, people aren't thinking exercise is not safe. In addition to that are untrained healthcare providers. So, physicians, nurses, they go through a ton of schooling, they learn a lot of material, and they concentrate on their specific field because there's so much to cover during these appointments that they have with patients and survivors and questions that caregivers have as well. So there's really limited amount of time to cover and think about things that are complementary to the information that they're giving. And that includes exercise as well. And exercise is not part of the medical school curriculum. Medical students might walk through the gym if there is a gym at their medical school, and there might be a personal trainer that might talk to them about the benefits of exercise, but not specifically for cancer patients and survivors. So it's just not part of their repertoire and of their knowledge to know the benefits. And they might not know someone they can refer to because us as exercise oncologists are kind of rare depending on what institution that you are in. And the last is exercise is kind of a double-edged sword. So especially in lymphomas and blood cancers, there are a lot of side effects that you could be experiencing from your specific disease and from the treatment that you're being given, such as anemia, some type of thrombocytopenia, neutropenia. Right, all these words are probably ringing something in your ear. And sometimes exercise is discouraged because of the safety factor, right? We don't want patients to accidentally fall, hit themselves, and then end up back in the hospital, which is absolutely true. But that's given if you don't know how to modify exercise to make sure that it is particularly safe. And again, like I said, healthcare providers aren't trained in that specific area to be able to know, okay, if this is the exercise you're doing and these are the side effects that you're feeling, this is how we're going to modify it to make sure that you're safe, but you're still, being active as well. So, excuse me, what we need to do is we need to treat exercise as medicine. As Paul was saying, there was a presentation yesterday about nutrition as medicine. It's the same thing as exercise as medicine. So I'm going to put two statements up on the board, and they're similar in a way, but they're told by two different providers. So just to give you an example, as how we treat exercise as medicine. So if you go to an oncologist appointment and you're getting ready for treatment, we're specifically talking about chemotherapy in this instance, right? You might hear something along the lines of an oncologist saying, I'm going to prescribe you these particular pre-medications before you start your infusion. We're going to give you your full chemotherapy today, so your 100% dose of chemotherapy. We won't reduce it. We're going to send you home with these medications to help you with any side effects that you might be feeling, maybe neuropathy, maybe some GI issues, maybe some anxiety. You'll come back in 3 weeks so we can repeat this chemo. And depending on how many side effects you have or have had and then how bad they are, we may change your treatment or we may keep it the same, right? So that might resonate with you, might sound somewhat familiar, and some oncologist has probably told that to you if you've had some type of treatment, right? So what if we took this statement and then we revised it based on exercise? So instead, I would say, I'm going to prescribe you 2 days of strength exercise. We're going to focus on your lower body just because you've been telling me that you've been having a hard time getting up and getting around. And because of the numbness from your neuropathy in your lower extremities and your feet, I'm also going to prescribe some balance exercises to help to reduce the risk of falls. And since it's nice outside, such as today, let's add 20 minutes of outside walking 3 times a week. When you come back in 3 weeks for your clinical appointment, we'll meet again. We'll reevaluate how those exercises went, how much you were able to do, and see if we need to change anything, right? And that was said by an exercise oncologist, specifically me, to about 100 patients. So you can see the similarities between these two statements, and they're two different types of medicine, and no one's to say that we're trying to replace chemotherapy with exercise, but it is a complementary to the chemotherapy or whatever treatment that you might be receiving. Right? So we can structure exercise in a way that we structure medication. And just kind of drive that point home, the graphic on the left is a chemotherapy order that you would see in a medical institution, right? You're giving all drug 1, 2, 3, 4, 5. This is the dose that we're going to give you based on your body surface area. This is percentage. We're going to sign off on it. And then the graphic on the right is an exercise prescription in a referral form that physicians can give to an exercise physiologist if there is one in this institution, and we can fill it out and give you X amount of days of aerobic exercise, X amount of days of strength exercise, and so on and so forth. So again, it's driving home the point that exercise is medicine in addition to the actual medication that you are receiving. All right, so I've told you that we need to exercise. So what do we know about the benefits of exercise, right? So Elwood always has this infamous line, exercise gives you endorphins, endorphins make you happy. And that is true, right? Exercise can give you endorphins, but in addition to that, the research that we've been seeing has given us a lot of more information on what the benefits of exercise are. So just have a really quick slide on treatment-related effects, right? What are we feeling after we get some type of treatment? I don't want to harp on this too much because I would just be kind of repeating what everybody already knows or has experienced already. But with specifically lymphoma, you might be getting a multi-drug chemotherapy regimen, so drug 1, 2, 3, 4, 5. You might be in conjunction with radiation. And depending on your lymphoma and the stage and the progression, you might head to stem cell transplant or bone marrow transplant, as it's better known. And then whatever combination of treatment that you might be receiving for your specific lymphoma, you might have any one of these side effects, one or more or all of them, right? And I see a lot of heads shaking. The number one side effect that I always hear of every patient that I've ever worked with is fatigue, and that's across the board of all cancer sites in lymphoma, including 60–100% of people report fatigue at some point, and that's also cancer-related and treatment-related. You might be experiencing muscle loss and weakness, and that might be because of just the sedentary lifestyle you're living, getting treatment, being in and out of the hospital, dealing with your side effects. Decreased quality of life, your reduced functionality, right? Your inability to kind of carry on the activities of daily life that you usually do. Pain, neuropathy, sleep disruption, I know is a big one. I know there was a talk about sleep. Depression, and cognitive changes, right? The way that we are thinking, sometimes you hear about chemo brain, right? That's cognitive changes. We can't remember things, or it takes us time to comprehend them or recall them. So you might have experienced some of this, or taken care of someone who has experienced this. So luckily, as we have progressed in time, I just want to show you this quick graphic about exercise in lymphoma research. So like I said, the really old school way of thinking of exercise, especially in lymphoma and blood cancers, is that no one really wanted to work with these patients with lymphoma and blood cancers because they thought it was unsafe. So if you go back historically to the 40s, there was maybe a handful of exercise in lymphoma research studies, and that's probably just them getting them out of bed and doing some type of physical therapy that was ordered by their physician. And as time has went on, there's more funding and there's more interest in exercise in lymphoma research, where we're now in the double digits, and we've seen the benefits of exercise in lymphoma specifically. So based on these studies over the past 50, 70 years, can't do math, there are 4 categories of benefits that I want to talk to you about. So with exercise and lymphoma, this is just lymphoma specifically, the first category is the cardiovascular system. How is it beneficial for our heart and our cardiovascular system? So exercise has been shown to be cardioprotective. So if we exercise before and we can increase our cardiac function before we even get to treatment, the side effects of the treatment that you'll be receiving will have less of a severe effect on your cardiovascular system. And if you've already gone through treatment and you've experienced all the side effects, exercise can improve your cardiac function as well. It reverses any deconditioning that might have happened while you were getting treatment. It reduces lymphedema. It actually does not increase lymphedema, which was a big way of thinking in the medical field for a long time. It improves your blood pressure, and I know hypertension is a big thing in lymphoma, and then it improves circulation as well, right? So that's just category 1. Category 2 looks at functionality and the musculoskeletal system. So exercise, surprisingly or not surprisingly, improves your muscle strength, depending on the type of exercise that you do. It improves your physical function, so your ability to kind of go back to daily life and do the things that you want to do or have been doing. It improves your range of motion, and this is specifically important, especially for patients who undergo surgery as well. Once you get surgery, your musculoskeletal system goes into protective mode and tends to shrink. So you need that flexibility and range of motion exercise to kind of help you get back to where you were. It improves bone density as well. So resistance training provides a physical stimulus on your bone to let your bone know, hey, let's get rid of this old bone cells and produce new ones. So exercise is the only thing, and specifically resistance exercise with strength and jogging and physical impact will help signal to your body that we need to improve the bone density. And lastly, it improves balance as well. So like I said, there is no pill to improve balance. There might be a pill for your dizziness or nausea, but the actual physical balance, there's nothing except exercise. The next set of outcomes are psychosocial, so things that patients report to us, usually on surveys, if you ever had to done a survey for a research study, or if your physician asks you to complete a survey. So exercise is the only pill and non-pill form of medication or medicine that helps reduce cancer-related fatigue. And a lot of times it seems counterintuitive, because if you're tired, you just want to rest. And so you rest, and then it becomes this vicious cycle of we're just resting and we're more fatigued, and we're resting and more fatigued, where exercise really actually helps to reduce fatigue. And this is not based on some type of biomarker from your blood. This is patient reported. So patients are telling us, like, I did this amount of exercise and I feel so much better, and my fatigue has really decreased 10, 20, 50%. It improves your quality of life. It reduces anxiety, especially when you're going through treatment or in survivorship and trying to figure out how to get back to normal life. It does improve sleep, which I know is a big complaint in a lot of patients. It improves depression twice, because it works really well. And the last category it looks at clinical outcomes, so things that physicians are really interested in and want to know is that, can it improve survival? Yes, exercise can absolutely improve survival in cancer patients and cancer survivors, lymphoma included. So a lot of research has been done in breast cancer just because of the amount of funding that's available and the amount of patients that are available to do the research. But exercise and lymphoma research has been now showing that it can improve survival rates. It definitely improves immune function, and one of the many ways it does that, again, is through the stimulation and physical impact of the bone, where a lot of our blood cells are coming from and our immune cells are coming from. So again, that physical impact on the bone is telling our immune system to kind of regenerate all of these immune cells that we need that can help us during cancer treatment and survivorship. It improves treatment tolerance, meaning that you ever gone to get chemotherapy and you're like, I can't, it was so severe, I can't do it again, and your physician will probably reduce the amount of chemotherapy that you give, maybe 85%, 70%, depending on your side effects. But those patients who actually exercise while they're getting active treatment can actually tolerate a normal amount of chemotherapy with a reduced amount of side effects. And we've shown that in a large body of different types of cancer treatments, cancer sites, where we've seen that patients can tolerate a higher percentage and actually get to the end of their chemotherapy. And lastly, it reduces recurrence, right? Where a lot of times there's anxiety around, is my cancer gonna come back? Is it gonna come back worse? Is it gonna come back in a different form? So we've been showing now in mice models and in humans that exercise can help reduce the chance of recurrence in a large amount of cancer sites, lymphoma included. Okay, so hopefully I've driven home the point that exercise is beneficial. So how do I get started? What do I need to do? Who do I need to see? What videos can you give me? So some things to consider before we even start talking about exercise is that safety is always the #1 priority for exercise, right? Like I said, exercise is medicine, in addition to the actual, medicine that you're getting from your physician. So it's important to know that there has to be a balance between the two. It's obviously stated that you need to be aware of your current health current immune health. So if you're going to get blood work on a regular basis and your doctor tells you, you're neutropenic, you're thrombocytopenic, you're anemic, that's something to be aware of because that plays into a factor of your safety during exercise. There needs to be a balance between how you're feeling currently and then your exercise progression. So a lot of times what happens with people with exercise is that we do the same exercise over and over and over again and we don't see any change because there's no progression, there's no change, so you can't expect to see change. And so then we overcompensate and then we try to do more than we can actually take on. So it's important to know how you're feeling and then when is it actually safe to progress to the next step of intensity for your exercise. The next thing is to have a goal in mind. A lot of times patients think that, okay, I just need to exercise, that's my goal. But that's not really a goal, right? Let's get down to the specifics. Do you want to be able to just go back to cooking and cleaning in your house by yourself? Do you want to run a marathon? Do you want to join a bodybuilding competition? Whatever your goal is, there has to be a specific goal so we can give you a specific type of exercise modified to whatever you want to do. And then the last thing I tell a lot of patients is that you need to set yourself up for success by knowing yourself. A lot of times we see all these trends of exercise and diet, and realistically, we're not going to achieve those because it's not meant for us. So, for example, I know myself, I don't like cycling, I don't like biking, but if you put me in a cycling studio where someone's yelling at me and there's really loud music, I love it and I'll go, right? So if that's something that you like to do, then you have to set yourself up for success and do that thing, right? If you hate running, don't sign up for a 5K, do something else that can get you exercising and maybe eventually you'll make your way to that 5K. So there's always steps to get yourself there, but you just have to make sure you are selecting the right thing to get you where you want to go. Okay, so the next couple of slides are going to be case studies based on patients that I've worked with before. They're going to be at 3 different time points. We're going to talk about a patient that has not gone through treatment yet and is prepping for treatment. We're going to go through a patient who is going through treatment currently, and then a patient who is transitioning into survivorship. And we'll talk about the different scenarios and how I would give exercise for that. And hopefully you can maybe recognize yourself or recognize someone that you might know in these slides and kind of take something away from these slides. Okay, so case study number 1, like I said, this is before any type of treatment. We have a 65-year-old female. She has pre-existing conditions, including high blood pressure, but that's controlled with medication. She has osteopenia, so she doesn't have osteoporosis yet, but she does have lower bone density than normal for someone who is of her age and her sex. She has arthritis and low muscle mass. She is not a previous exerciser and not a current exerciser, but her hobbies include gardening, playing with her grandchildren, and going for leisurely walks when the weather permits. She has 4 weeks until the start of treatment. Currently no symptoms because she has not received any treatment, and her personal goal is to get ready for treatment, right? So we have 4 weeks to do that based on all of these criteria. So the pie chart that I showed in the beginning with the 5 components of physical fitness, where each was split into 20%, we're now going to change that and we're going to modify it, okay? So if you look at the pie chart on the left-hand side, we can see that I've split now the pie chart to 50% strength training, 30% aerobic, 10% of rest and relaxation, 5% balance training, and 5% flexibility and range of motion, okay? So, and then on the right-hand side is a table that looks at what are our goals, what's the exercise I'm gonna give to target that specific goal, and what's the frequency of the exercise for that specific goal. So if our goal is to increase muscle mass and strength and maintain bone density. So if you have 4 weeks until your treatment and you have low bone density, there is no scientific way that you could improve or increase the amount of bone density in just 4 weeks. So it's important to realize what can we maintain what we currently have so it doesn't get worse versus actually improving it. So we want to maintain the amount of bone density she has so it doesn't decrease in the 4 weeks until she gets treatment and decrease even more while she's actually getting treatment so that she might accidentally fall into being osteoporotic. So with that, we want to do strength exercises. So for someone who's never done exercise before and is, not a current exerciser, I'm not going to go send her to a gym and be like, figure it out, push some weights around and you'll be fine. So we're going to do strength exercises at home. And they're body weight exercises, so you don't need specialized equipment. But if you want to splurge a little bit, you can get resistance bands, and those are very inexpensive. And those, honestly, are what I give patients, and they're maybe $15 on Amazon. So that's a very nice introduction into resistance training and gives her enough to increase whatever muscle mass and strength that she has. And then we're going to do that 4 times a week, which seems like a lot, and it's double what the guidelines I just talked about previously. But if you think about it, she only has 4 weeks until treatment. So if she's not having any terrible side effects, we can give her as much physical stimulus in terms of exercise in a safe amount up until she gets her treatment in 4 weeks. And that's 4 times per week. In addition, we want to maintain her aerobic capacity, so her cardiovascular function. So if she likes walking outside, then we're just going to keep walking outside. But we're going to tell her, I'm going to have you walk a little bit faster. I want you to feel your heart rate a little bit elevated. And I want you to do that 3 times per week, structured, not just a leisurely walk. Make it 20 to 30 minutes each session, or altogether per day. And lastly, rest and recovery, because we don't want anything happening to her before she gets treatment that might delay her treatment, right? Again, it's all about safety. So for rest and recovery, I always like to give light stretches because it makes people feel like they're doing something, which it is, and mobility and balance exercises to make sure that she's just getting up off her feet and not just being sedentary during her actual rest days. And so what I like to emphasize with this is that it can be a combination. You don't have to do everything every day. It could be, strength training and aerobic training on the same day. Or if you're feeling really worn down or you have a lot going on in your, other life, you can break them up onto different days. And it can be done during the whole day. A lot of people are like, I don't have 30 minutes to go walking outside. And that's perfectly fine. If you do 3 bouts of 10 minutes each, cumulatively, that's still 30 minutes, and that still counts. If you only want to do 1 set of, let's say, chair stands or squats in the morning and then 1 set in the evening, that still counts as well. So it's really just about playing around with what your current life looks like and allows and what's going to be beneficial for you. Okay. So next we're going to move on to case study number 2, and that's for someone who's actually undergoing treatment. So we have a 55-year-old male who's currently receiving chemotherapy every 3 weeks. Pre-existingly, he has type 2 diabetes, which contributes to the peripheral neuropathy, the numbness and burning in his feet. and he's overweight based on his BMI. Symptoms, he's experiencing fatigue, neuropathy, anxiety, muscle weakness, and anemia on and off. His hobbies include golf and walking the dog, and he has previously exercised before, doing weights and cycling, and luckily he has a stationary bike at home. And his personal goal is he wants to complete treatment and he wants to get back to work as soon as possible. So looking at the pie chart on the left-hand side, now we've modified it a bit based on the fact that he's undergoing treatment. So you can see there's a equal proportion of aerobic exercise, strength exercise, and rest and relaxation. Because he's undergoing a very intensive treatment period, we do want to give him something to do, but we want to make sure that his body recovers in time to be able to do the exercise and then make it back to chemotherapy in every 3 weeks. And then we'll throw in some balance training and flexibility and range of motion just because he's having some issues with his peripheral neuropathy in his lower extremities. So again, his goal is to maintain strength. So one thing I like to emphasize to a lot of patients who are undergoing active treatment is that there is no way to improve health outcomes. It's all about maintaining what you currently have, just because your body's going on onslaught of different side effects from your treatment. So it's about maintaining what you currently have instead of losing what you have. So we're doing strength exercises, body weight and resistance bands, just because if you're immunocompromised, you're not going to a gym in a crowded area. So whatever you can do at home. If you do have weights at home, use the weights. If not, body weight and resistance bands are perfectly fine. And then we'll stick to 2 times per week just because chemotherapy is very intensive and it takes a few days, maybe a few weeks, you'll feel back to normal and have the strength to do exercise. We also want to maintain his aerobic fitness and reduce his fatigue. And like I said, exercise is only pill and non-pill medicine to be able to reduce fatigue. And we'll take advantage of what he has, which is a stationary bicycle at home. And that's quite safe because you're not, on the road, you're not outside, you're just still in your home. You can stick yourself in front of the TV or turn on some music. A new stationary bike 3 times per week, starting maybe 5 to 30 minutes, depending on how many days out you're from chemotherapy. If you're 3 days out, you're probably feeling really crummy, and you're like, there's no possible way I can even, get up off the couch. But let's say 5 days from chemotherapy, you're like, I have a little bit of, gas in the tank. Take 5 minutes, cycle at a leisurely pace, come back, a day or 2 later, up that to 7 to 10 minutes, so on and so forth. And then last, we want to reduce the risk of falls because he's having neuropathy in his feet. And we want to make sure he gets enough rest to be able to make it to the next 3 weeks of chemotherapy. So just very light balance exercises that you can kind of do, standing in the kitchen, brushing your teeth, and mobility stretches to make sure there's no muscle shortening during the sedentary times when he's just kind of resting in bed. And that's 1 to 2 days as well to make sure you have enough time to recover for your next treatment period. And last is after treatment. We've completed treatment and we're now transitioning into survivorship. So we have a 70-year-old female. She's underweight based on her BMI just because she wasn't eating quite well during treatment. And again, she has peripheral neuropathy in her feet. She completed chemotherapy 3 weeks ago. She has severe fatigue just because of the cumulative nature of chemotherapy. She has neuropathy, GI issues, and poor sleep and anemia. Previously exercised, walking and light weights. She has a treadmill, but it's currently being used as a clothes rack. And her hobbies include walking the dog, cooking and baking, and gardening. So physical activity type exercises that she likes to do. And her personal goal is that she just wants to feel normal again. She just wants to go back to her life before treatment. So the pie chart is now a little bit modified where now we're going to more concentrate on aerobic exercise. We will do strength exercise just because she's underweight and has lost a lot of muscle mass probably from the chemotherapy and just sitting and resting from the fatigue, balance and flexibility. And like I said, 20% rest and relaxation because you just finished treatment. Just because you just finished treatment does not mean that the symptoms just go away, right, as we all well know. We want it now, the survivorship period is a great time once you start feeling less of the side effects to start improving rather than maintaining whatever physical fitness components you have. So instead of maintaining your muscle mass and strength, we now want to concentrate on gaining more muscle mass, gaining more muscle strength. So we're going to do strength exercises 2 times per week as we start out, and we might increase that as her side effects kind of dissipate over time. We want to now improve her aerobic fitness rather than maintain, reduce her fatigue, and improve her sleep with treadmill walking. So she has a treadmill at home. She doesn't need to go to a gym. And again, we start off small, 5 minutes, and we can work our way up to 30 minutes. And then last, we want to reduce the risk of falls because, again, she does have low muscle mass, so nothing really to kind of help guard her from falling. So we'll concentrate on balanced exercises more than mobility, and rest as needed because, again, she's still going through the throes of just finishing chemotherapy, and that's 1 to 2 days. And again, you can kind of combine those on the same day or spread them out during the 7 days of a week. Okay, so I know I've talked a lot, and you're like, that's a lot of information. I don't know if I can, make my own exercise program, and that's perfectly fine because that's what exercise oncologists are for. So I have a few resources for you that I hope will help you out if you've reached the next stage of change and you're like, okay, I'm thinking about exercise, or you know what, I haven't exercised in a week, I want to go back to exercising, or if you're a regular exerciser, I need something to spice it up. So the first resource I have is through Moving Through Cancer, and that's an international task force and initiative through the American College of Sports Medicine. And what we're trying to do is to get exercise integrated into standard of care for all oncology patients, including lymphoma as well. And so we're doing policy and scientific research. And what we've developed is a really nice patient portal. If you can scan the QR code, it'll take you to the online website. And there's also some booklets that I've smattered around and flashcards as well with the QR code. If you go there, there is the booklet, and it looks like this if you're looking around for what the booklet is. It talks about the guidelines and the benefits of exercise and different resources that you can look through as well. The online version, if you just like online, is also there if you go to the website. And there's also an exercise registry that we're updating on a weekly basis. So this registry includes exercise programs and exercise professionals who are specialized in cancer. So personal trainers, physical therapists, exercise physiologists like myself, we put ourselves in there if we provide a service for patients with living with or beyond cancer. So you can put in your zip code and it'll tell you programs that are surrounding you if you're interested in getting involved in exercise or you need a little bit of help with guiding yourself to exercise. So it's a really nice resource that's still being developed and updated every day. So I encourage you to check it out. The next resource is an app for your phone or your tablet, and it's called Cancer Exercise, easy enough. It was developed by one of the leading exercise oncology professionals, Dr. Anna Schwartz from University of Nebraska. It's completely free, and it's on both Android and Apple as of 2 weeks ago. And it's really nice because it takes stock of, it asks you, what is your current cancer, or what cancer are you a survivor of? What current symptoms are you experiencing? What's your current exercise level, and what's your goal? And then based on the input that you put into the app, it will create an exercise program for you and give you graphics on how to do the specific exercises. So if you're interested and you're one of those people that needs that guidance and you like it on your phone or your tablet, I would encourage you to try this exercise app. And like I said, it's completely free as well. And last but not least, the Penn State College of Medicine, through the ONE group, which is the Oncology, Nutrition, and Exercise group, has created a patient website just for patients, caregivers, and survivors for exercise videos, patient guides, and sample workout plans. And these are, we have, I think, at least 3 dozen exercise videos that encompass upper body exercises, core exercises, and lower body exercises, demonstrated by yours truly and some of my colleagues, and it gives you modified versions as well. So if you feel like you can't get out of a chair but you still want to use your lower body exercises, we have a video for that, right? If you feel like you want to do upper body exercises but you don't have any equipment, we have a video for that. So there's a ton of modifications that you can see through these exercise videos. There's patients' guides on side effects, and there's actual workout plans if you need guidance on how to kind of group those different exercises together and make one cohesive plan so you have something to stick to. So check out the Penn State ONE group website. It's a really rich resource that, again, is free for anybody to use. And that's it. Thank you.